Hospitals and physicians are making difficult choices to contend with an almost certain shortage of ventilators in the coming days, as the coronavirus rapidly spreads throughout the state. Emergency physicians are already being told to use their judgment in deciding who should be hooked up to a ventilator as stockpiles of the essential equipment dwindle. And hospitals are converting machines typically used to treat sleep apnea as bidding wars, and supply constraints make it nearly impossible to acquire enough ventilators and protective equipment ahead of the projected apex of cases in New York. Medical experts have warned there will be long-term ramifications both for the physical health of patients and the mental health of the doctors faced with life and death decisions, but the worsening pandemic has increasingly made such choices a necessity. Fauner advised medical centers to refer to the State Department of Health's 2015 guidelines on ventilator allocation as a framework to inform policy decisions. The guidelines were written to help hospitals decide who should get ventilators in the event of an influenza pandemic. But in a sign of the delicate balance between saving lives and calming a nervous public, the state health department is saying its own guidance is not official policy. Physicians are already expressing worries they will soon have to make tough ethical decisions to provide care without extra ventilators, with the New York chapter of the American College of Physicians calling on Gov. Andrew Cuomo to grant doctors immunity from liability for the decisions they make, according to a report in the New York Times. Mayor Bill de Blasio recently refused to discuss plans for how to ration care if there are not enough ventilators to go around. Ventilators are in such short supply that even Tesla and SpaceX CEO Elon Musk couldn't get his hands on them after promising to donate hundreds to the state. He shipped CPAP and BiPAP machines that are intended to help people with sleep apnea breathe through the night, according to two sources familiar with the matter. Hospitals have scrambled to repurpose the machines to beneficial use. They will have to add extra HEPA filters and use them for patients with less severe symptoms, one official said. The state health department approved Northwell's protocol allowing BiPAP machines to be converted into ventilators, Cuomo announced on Thursday. He said the state has acquired 3,000 of the machines to be deployed to hospitals with the greatest need. Cuomo warned Thursday that the state could run out of ventilators in just 6 days. There are now more than 92,000 confirmed COVID-19 cases in the state and more than 2,300 deaths.